advanced fertility treatments. The more advanced fertility treatment is mainly based on the in vitro fertilization, or the IVF. And you will notice a lot of these uncommon abbreviations in the most advanced fertility treatment. But basically, the main thing is that the fertilization of the egg happens outside of the body. So this way, instead of this happening in a tube, we have an egg in the petri dish in a laboratory that is either fertilized with an injection of the sperm into the egg, or the sperm is just placed next to the egg. So there are two ways actually we can fertilize the eggs. So once we fertilize the egg, the following day we need to make sure the embryo develops, and basically the embryo can stay for about 5 to 6 days in the laboratory, and we can observe it. We can see how the cells cleave. We can see it go through different stages, and some of them are not going to make it. So some of the embryos are basically going to arrest, and then by the 5th or 6th day we're ready to either freeze it or transfer it back into the uterus. If we freeze it, we go ahead and vitrify it. The vitrification is a method where we employ basically rapid freezing. So the embryo is transformed from liquid state into solid state like within a fraction of a second. So we do the rapid freezing, and by doing the rapid freezing we avoid crystal formation in the embryo. The damage really doesn't happen with the freezing or with the storage. If some damage happens, it's usually with the thawing of the embryo. So how long, if it's frozen for 1 day or 15 years, it really doesn't matter. It's mainly the process of thawing the embryo. When it's frozen in liquid nitrogen, there really is no expiration date. We believe then you can keep it for 15, 20 years.